introduce myself first. My name is Dr. Claudine and I will be your host for today. And our guest speaker is one of our family medicine doctor who is also a clinical nutritional specialist. And she will be talking about good diet and healthy eating for our senior citizens. So let us all welcome Dr. Maria Luisa Manlapaz or Doc Malu. Hi, Doc! Hi, Doc! Good afternoon!
Thank you very much for that kind introduction, Doc Claudine. Sa ating pong mga viewers, magandang araw po sa inyong lahat. Ako po ay nagagalak at naimbitahan po ako dito sa ating health YouTube or health channel. At ngayong hapon na ito, importante po ang pag-uusapan natin, no? Kasi sineselebrate po natin ang ating Nutrition Month. At ang theme po sa ating Nutrition Month ay malnutrition, patuloy na labanan, yung first 1,000 days tutukan. Pero minabuti po namin sa organizing committee na pag-usapan din po ang tamang nutrisyon sa ating mga lolo't lola. No? Meaning to say, ito po ay isa sa mga grupo na vulnerable to malnutrition as well. That's why it is important that we talk about this. Thank you very much.
Okay, so nasabi niyo na Doc na actually when we go to the senior age, may chance pa rin ng malnutrition which can actually lead to different non-communicable disease o yung mga iba't ibang sakit lumalabas na, 'di ba? Sabi nga nila life starts at 40 and of course and above. So with that, Doc, ang first question ko po, when we get to that age, let's say pag mga 50 years old to 90 years old, o kung yung iba nasa swertehan, umaabot ng 100 years old, meron ba silang dapat bawasan or do they have any food restrictions po when we get to that age?
Okay. Napakaganda po ng tanong nyo, no, Dr. Claude. Una sa lahat, sa bawat pasyenteng nakikita namin, no, among the elderly population, sa ating lolo't lola or our parents, kailangan muna natin i-assess maigi, no po, yung nutrition assessment na tinatawag. So una sa lahat, kailangan malaman muna namin kung ano yung nutritional status niya. So isa sa mga importanteng mga tanong na kailangan naming tanungin sa kanila, first, kung merong history ng anorexia, no? Kung meron loss of appetite, okay? Kung merong history of weight loss, okay? Kung merong ano po ba ang kanyang mga sakit, no? At saka kung ano po ba ang nagiging activity niya sa araw-araw, siya po ba maganda pang ang physical activity or more of bedridden lang siya. So these are important questions sa nutrition assessment. And then also part of the nutrition assessment yung kanyang weight and height. Kukunin namin at least yun ang basic, no? Anthropometric measurements po ang tawag doon. And then yung tanong niyo po kung ano po ang dapat i-cut niya na kailangan tanggalin sa kanyang diet, depende yan, one, from the nutritional status based on the nutrition assessment that we did in the first place. And then secondly, ano po ba ang mga sakit ni lolo't lola, no, or na ating mga magulang. So, syempre, yung diet na ibibigay namin is individualized po yan, no? Hindi yung one diet fits all. Iba-iba po yan. Kung ang problema po ng ating pasyente ay hypertension, hypertension tapos meron din siyang tinatawag na dyslipidemia o mataas yung kanyang cholesterol, triglycerides. So definitely, ang kailangan niyang cut sa diet yung kanyang fatty food at saka salty food, no? Kung siya naman ay diabetic, kailangan naman bawasan natin ang carbohydrates in the form of rice, pasta, bread, sweets. Napakarami po, no, yung mga carbohydrates or mataas sa sugar content. Kung siya naman merong chronic kidney disease, as much as kailangan natin bigyan talaga ng mataas na protina ang mga may edad na, pagka hindi pa po siya dinadialysis, kailangan po mag-ingat tayo sa protina. Kailangan babawasan natin. So, depende talaga sa nutritional status and medical problem, all of those things, doon nating malalaman kung ano ang kailangan nating ibawas sa kanyang diet, kung ano ang most appropriate diet for the patient. Importante rin po sa nutrition assessment na ginagawa namin yung tinatawag na 3-day food record, no? So, para malaman po namin ang kanyang dietary habits at saka kung ano yung usual food that the patient eats, no? O kaya mga beverages that he drinks, kailangan po natin ng 3-day food record. Ano po ba yon? At least for 3 days, ideally, 2 non-consecutive weekdays and 1 weekend, ililista niya po lahat ng kinain niya from breakfast to dinner. Pati lahat ng ininom except water kasi wala namang pong calories ang water, no? And then from there, mabibilang namin kung ano yung usual caloric intake niya at saka protein intake niya. At saka makikita namin kung ano yung choice of food niya. Kung high fat ba, kung maganda ba ang choice niya. So from there, we'll be able to see what we need to modify. Kung ano yung dapat nating palitan, dapat tanggalin, at kung ano yung pwede nating ipalit. Okay? So this is actually a multidisciplinary approach. No, hindi kakayanin ng doktor lang ang nutrition management. That's why in our team, in the Medical City South Luzon, we work as a team. So I work with our clinical dietitians, no? Once I prescribe the diet for the patient, then I refer to our clinical dietitians. Tapos ang ating mga dietitians ang magbibigay ng sample meal plan, ang magtuturo sa pasyente ng food exchange. Ibig sabihin, tuturuan din po sila, pag ito po ang kinain nyo, 1 cup of rice, ilang calories po yan. Meron po bang protina yan? O pag kumain po kayo ng a piece of chicken leg, ano po ba yan? Ilan po ba ang protina niyan, no? Ilang calories po yan? So, all of those things, talagang medyo meticulous po talaga ang nutrition, mathematics din po yan. Mahirap initially kasi we teach them how to read the nutritional facts. Di ba? Pag tayo nagpupunta ng grocery, titingnan natin yung nutritional facts, no? Tapos, sinasabi doon kung ilang calories, kung ilang fats, kung ilang protein. So, tinuturuan din namin sila how to read the nutritional facts para they will make the right choices in terms of the food at saka the right amount. The right amount. So, all of those things, we teach them, no? Para they will be educated on what would be the appropriate diet for them depending on their medical problem.
So, talagang first question pa lang na-explain na ni Doc lahat. So, yan mga lola ko at lolo ko. From Dr. Luisa, alam nyo naman na hindi naman lahat ng pagtatumanda tayo ay wala na tayong kakainin. So, di ba, minsan, pag nasa doktor tayo, sasabihin yung bawal yung ganyan, ay sasabihin natin, wala na pala kaming kakainin. So, hindi po tama yun. So, tama dapat kailangan mag-consult tayo. May tamang nutrition pa rin para sa inyo. Ang kailangan lang is ma-educate po kayo. Tama po, Doc? Ayan.
Yes.
Okay. So, ngayon naman, Doktora, since na-mention nyo na rin kanina yung mga difficulties of our lolo and lola, so what about those who have like decreased appetite and yung iba naman, they experience yung difficulty swallowing or yung food indigestion, how do we advise them or how can we give them some good, healthy, or eating habits po?
Okay. Thank you for the question, Dr. Claude. Alam mo, napaka-common yung problemang yan, no? Yung loss of appetite among the elderly. Una sa lahat, kailangan nating imbestigahan kung ano po talaga ang dahilan kung bakit may loss of appetite or difficulty in chewing or swallowing, no? So, kailangan natin, of course, yung history taking importante po yan. Malaman natin kung ano po ba yung mga medical problem niya. Baka naman merong malignancy or cancer, no? So most of our patients who have cancer would complain of loss of appetite, no? Other than cancer, marami pong mga chronic illnesses, no, like heart failure or COPD or kidney disease or diabetes. All of these illnesses will affect the appetite of the patient. So that's one, no? We have to investigate kung ano po ang mga sakit niya. And then number 2, we also have to know yung list of medications niya. Okay? Kasi meron din pong mga gamot na nagkukos ng loss of appetite, nawawalan sila ng gana pagka umiinom nitong mga gamot na to. Isa sa mga common na madalas iniinom ng elderly yung tinatawag na proton pump inhibitor, na po katulad po ng omeprazole, mga pantoprazole, yan. Karamihan sa kanila matatagal na rin pong nagte-take ng medication na yon, that can also cause anorexia or loss of appetite. Katulad ng mga antibiotics, yung mga metronidazole o yung mga chemotherapy, yan, that can also cause loss of appetite. So may mga gamot din po na pwedeng mag-cause niyan. Tapos number 3, marami pong changes na nangyayari sa katawan, natin as we get older. Okay? And these are natural changes or what we call physiologic changes that happen as we get older. Let me just focus on the gastrointestinal tract, dun sa changes, since we're talking about nutrition. So, ang nangyayari, nagdi-decrease po ang nutrient absorption as we get older, pati po yung digestion nagdi-decrease. And even yung sense of yung sense of smell, sense of taste, there is a taste and smell alteration, So yung nagdi-decrease yung sense of perception, pati olfactory, pati yung sa vision, all of those nagdi-decrease. So basically, in terms of yung eating, yung sense of taste and smell na alter din, Kaya maririnig niyo po, wala po akong panlasa parang lasang kalawang, ganyan, Minsan naririnig natin sa ating mga lolo't lola. Tapos, ang pwede ring cause po ng loss of appetite, loneliness, katulad na nangyayari or depression, psychological reason, like katulad na nangyayari sa atin ngayon, ngayong pandemic, most of the time nakakulong lang po sila, di ho ba? Sinasabi nga po ng mga pasyente ko, ano ba to, Doc? More than 1 year na akong nakakulong sa bahay, di ba? So, nakakalungkot kasi gustong-gusto mo makasama yung pamilya mo sa pagkain. So, nakaka-contribute din yon, nawawalan sila ng ganang kumain kasi hindi nila nakakasama yung buong pamilya na kumain. So, nagkakaroon yung social isolation and depression. That can also contribute. So, malaking bagay talaga ang support ng family. The love, the support of the family, yung time spent with our grandparents, with our parents. Kasi ang eating, it's more pleasurable if you eat it with your loved ones. Diba? So, that's why, ayun na nga, yung yung nahihiwalay tayo during this time, especially in pandemic, yun na nga, nakaka-contribute din sa pawalan ng gana. And then, marami pa, like in this pandemic, marami pong nawalan ng trabaho, okay? Nawalan ng, so, kumbaga, poverty itself, yung pambili mo ng food, ngayon ang nangyayari, kung ano na lang nandyan, delata na lang, bukas na lang tayo ng delata, which is high in sodium, high in fat, so hindi na siya nutritious. Kung ano na lang available dyan. So, yung knowledge then about good nutrition, yun din, walang knowledge of good nutrition, kaya kung ano na lang basta mabusog. Okay? Pero actually, empty yun. Puro calories lang siya, pero it's not packed with nutrients. Yung kinakain mo, kulang na kulang sa nutrients, puro calories lang. So yun. So lack of knowledge about yung proper food, to eat, that also contributes. So, as I said, yung mga physiologic changes that happen as we get older, yung minsan yung yung denture lang, hindi well fitted, kaya that can also cause loss of appetite. And in terms of chewing naman and swallowing, that we also have to investigate, no? Kung bakit hirap siyang mag-chew o hirap siyang mag-swallow, meron ba siyang neurological problem or other medical problem that may contribute to this. So, dito, papasok din, we need to ask the help of our occupational therapies or speech therapies, no? To further assess yung swallowing niya or chewing, so we will know the reason why, no? Kasi pagka alam natin ang dahilan kung ba't siya nahihirapan mumuya o mulunok, it's much easier to solve the problem if we know what the problem is. So that's one. So there are many things that we can do in terms of solution naman to all of these things, ano? There are many things that we can do to improve the nutrition of our loved ones, elderly loved ones. First, kung may problem nga sa chewing or swallowing, kailangan ibahin natin ang texture ng pagkain. So, kung kailangan i-blend the rice, then we have to blend the rice, no? I had a patient just recently na ganyan, elderly, na nasa almost 90 years old. Hindi siya nakakakain kasi nga yung food served sa kanya hindi niya gusto dahil nga matigas, hindi niya malunok, nahihirapan siya. Nung na-blend the rice, yun, nakakain siya. So yung pala, kailangan ibahin lang talaga ang texture, no? And then of course, we have to make it yung attractive, appetizing, no? Yung preparation niya, at the same time, since yun na nga, may alteration sa sense of taste nila and smell, kailangan medyo innovative tayo, magdagdag tayo ng flavor. So we can do that, but by adding herbs, no, instead of salt. Syempre kasi karamihan sa kanila hypertensive na, we have to cut down on salt. So kahit mga herbs, no, importante na maging tayo, creative. Okay? Creative when we prepare dishes for them. And of course, kung ano man yung medical problem, we have to address that. And then we have to refer to our dear specialists, our doctors, to help us with those medical problems. And also yung sa occupational therapies naman, we also help us with the swallowing or chewing problem, no? And then in terms of nutrition naman, then they can seek our help, no? They can seek our help kung ano pa pong pwede nating ibigay. Kung talagang yung nahihirapan siyang kainin ng natural food, meron pong mga tinatawag na oral nutritional supplements dyan. Napakarami po na oral nutritional supplements. These are in the form of milk, pero these are complete meal, no? It consists of carbohydrates, protein, fats, vitamins, and minerals. So we give this to our elderly patients if they're unable to tolerate the natural food anymore. So that can really help. So napakarami po niya. I won't mention the names anymore kasi baka sabihin nila nag-advertise ako, but yun na nga po, we call that oral nutritional supplements. So if you need help, no, our dear viewers, no, na those who have loss of appetite or have a swallowing problem or chewing problem, you can just visit us in TMC, no, sa Nutrition Management Service, and we will be able to help you.
Okay, Doc. So, talagang marami tayong ways and how we can help you, our viewers, para at least yung mga loved ones natin, yung mga lola-lola natin, ay ma-enjoy pa rin nila yung food. Because yun nga, like what Dr. Manlapaz said, we actually find pleasure when we're eating. And then, of course, yung mga problems na yun can be pathologic or physiologic. But in any case naman, we are here to help you. And there's always a way para sila ma-enjoy pa rin nila and they get to eat well and healthy. Ayun. So, actually, nasagot niyo na rin po, Doc, yung next question ko na if there are any special nutritional needs for our elderly or grandparents. So, ang last na lang na request ko, Doc, is meron po ba, before we close this segment, Doc, meron po ba kayong last message na lang po or advice for our dear senior citizens, our Lolo and Lola, in terms of yung pinaka tips nyo lang or advice nyo lang po habang nanonood sila sa bahay at maghahanda na sila ng food. So, ano po yung best na ma-advise nyo po sa kanila, Doc?
Okay. Siguro, before I proceed in giving advice, meron pa pong importanteng bagay na kailangan ko i-share, no? Para po malaman natin kung ano talaga ang tamang nutrisyon para sa ating lolo at lola. Una sa lahat, gusto ko lang i-share na marami pong changes na nangyayari sa katawan natin, ano, as we get older, no? Aside from the physiologic changes that I said about our gastrointestinal tract, meron din pong mga changes sa ating body composition. Anong ibig sabihin nun? Yung ating, as we get older, yung ating fat mass nag-i-increase, no? At ang ating muscle mass nagdi-decrease po yan. So, kung mapapansin mo, pagka nagkakaedad ka na, lumalaki na ang waistline ko mapapansin niyo yan, di ba? Lumalaki na. Kasi, ang predominantly, ang deposit ng fat mass, dito sa tiyan. Yung tawag natin visceral fat. At yun nga po ang nalilink sa mga cardiovascular diseases. Ng ganyan, diabetes. So yan, as we get older, yan po, nag-i-increase ang fat mass. Ang hindi maganda po, aside from that, nagdi-decrease din po ang ating muscle, ang muscle mass. Kaya po, vulnerable ang ating mga lolo at lola, ating mga elderly population to malnutrition. Basically, because of we are losing the muscle mass. And we call that, medical term, yung sarcopenia. Okay, sarcopenia is a syndrome characterized by progressive and generalized loss of the muscle. Okay? And eventually, when we're losing our muscle mass, eventually, our muscle strength will decrease, pati yung ating performance, no? Meaning our functioning magdi-decrease. So, this will lead to fall, kaya marami po sa ating mga lolo't lola yon, prone to accident, prone to fall, physical disability, yung mobility problem, they're prone to acute illnesses, no po, sila po yung nagkakaroon ng pneumonia, na-hospital, na ICU, no, all of these diseases, and eventually, yun na nga, develop malnutrition. So, ang tawag po dyan, sarcopenia, yun po ang medical term, no, we're losing our muscle mass. Now, knowing all of these things, ano ngayon ang talagang tamang pagkain? Kaya ito po ang gusto kong iwan sa ating lolo't lola. Ngayon na alam natin na we're losing our muscle mass as we get older. Alam mo ba, nagsisimula yan at age 40. There is a sustained or gradual decline of the muscle which starts approximately at age 40. Di lalo na kung 80 years old, nagdo-double na yan, talagang At lalo na kung halimbawa na-admit na ospital, no, na ICU, makikita mo ang bilis-bilis nilang pumayat. Talagang they're losing their muscles. Now, knowing all of these things, it is now important na to give adequate protein to our elderly, no? Dapat po talaga mas mataas ang requirement ng protina sa ating mga elderly, sa ating lolo't lola. At saka, hindi lang po yung basta itataas ang protina. Dapat po yung good choice, yung high biologic value na protina. Katulad ng fish, no, chicken, yan. Dapat lean pork, yan. Ngayon, depende na lang kung may iba siyang medical problem, no, na kailangan i-cut niya yung mga meat products, no. So, egg, it's a magandang po yan, source of protein. Ngayon, depende na rin sa pagluto. Kung hypertensive ka, mataas ang cholesterol mo, triglycerides, dapat hard-boiled egg instead of fried. Okay? So, dahil yun na nga, nag-i-increase ang ating fat mass, ang kailangan nating i-reduce yung fatty food. Okay? And of course, yung sobrang tamis, yung sobrang mataas sa carbohydrates. Okay? But we need to increase yung ating protina. So, marami ring source of protein from vegetable. We call that vegetable proteins, no, mga soy, no, mga seeds, good source of protein din yan, may nuts, okay? So, in other words, kailangan po balanced diet, no? Kaya we should be taking all the nutrients, may carbohydrates ka, may protina ka, may good fat ka, may vitamins and minerals. So, pag tinignan mo yung plate mo, no? We can, just imagine, pag tinignan niyo po yung pinggan, kalahati nun dapat gulay. No? So, dapat ang mostly nag-occupy ng plate natin ay gulay. Yun na talaga nutrient dense ang tawag po doon. Low in calories pero packed with nutrients. Tapos, 1/4 of our plate, ayun yung carbohydrates. No? Tapos, another 1/4, ayun ang protina. So, dapat sa bawat meal, may protina tayo, no? Sa elderly. Kasi it will help increase the muscle mass, pero kailangan sabayan din ng exercise para mag-increase ang muscle mass. But somehow, ma-delay, no, or not really delay, mag-decrease ang progression to talagang sarcopenia. So, dapat talaga importante ang tamang diet, tapos may ehersisyo, no? Exercise will also help increase our muscle mass. So, kaya both nutrition, proper diet, and exercise can help, no? Build our muscle mass. Yeah.
So, thank you, Doc, so much para sa mga advice nyo. Actually, yung last po na sinabi nyo, yung nutrition, tamang diet and exercise, even if hindi naman tayo senior doc, di ba, dapat ginagawa din natin yon even at the young age. Start them young tayo, di ba? So, dapat, even at young age, para ma-prevent natin yung malnutrition, ay we already practice good diet and exercise. Okay? Yes. So, thank you again, Dr. Luisa Manlapaz, for your time this afternoon. Sobrang dami kong na-realize sa mga kinakain ko. So, and of course, meron na rin akong masishare sa aking lolo at lola. So, sa inyo rin na viewers natin, I'm sure marami kayong natutunan today. So, we hope that you will also share the knowledge, share and educate your loved ones and your lola and your lola, your grandparents, your tito and tita about healthy eating and para sa kanila din naman to. And we hope that you will also share and our YouTube segment or our YouTube channel here and keep watching our video. So again, thank you, Dr. Manlapaz, for your time. So goodbye everyone, and till the next episode. Bye!
Bye!